Whether you've been diagnosed with lymphedema, lipedema, or another vascular swelling such as venous insufficiency, a certified lymphedema therapist can help you manage and decrease your swelling, help with any skin changes, and also help you with long-term overall function. My name is Kelly and I am a certified lymphedema therapist as well as an oncology clinical specialist and women's health therapist. In this video, I'm going to share when it is best to go see a lymphedema therapist, whether it's your first time or you've been following one for a while and you're not sure when it's time to go back. I'll talk about what you may see or what you want to watch for so that you know when it's time to give your therapist a call. So first, what are the benefits of seeing a certified lymphedema therapist? A certified lymphedema therapist is going to have a lot more intensive training than a general therapist. A therapist can be a physical therapist or physio, occupational therapist, massage therapist, or even a doctor. You will see the initials CLT after the name, which stands for Certified Lymphedema Therapist, or if you're in the United States with me, you may also see CLT-LANA, L-A-N-A. That stands for Lymphology Association of North America, and that is just a second tier of training. A therapist can create a personal and specialized therapy treatment program just for you based off your needs and symptoms. It's also great to have a certified lymphedema therapist established with your care so that you have someone to call if you have any urgent needs or you have a flare-up. Every country is going to be a little bit different on how to find it, but in the United States, you can search online to see who is a CLT-LANA, and I'll put a link down below for that to see who is in your area. So we're going to go ahead and go through the different reasons for you to follow up with your certified lymphedema therapist. So the first reason you should see a certified lymphedema therapist is if you have new or worsening swelling. If an area of your body, which is most commonly in the feet or the legs, starts to swell and it doesn't go away the next morning or after a couple days and you have no reason for new injury, you want to follow up with your doctor or see a certified lymphedema therapist. If you know you were at risk for swelling or lymphedema, such as you had lymph nodes removed for a cancer surgery, you can also watch to see if your rings or your jewelry get tight, if your clothes start fitting a little bit more snug, or if you have any feelings of heaviness or aching. In the feet or the legs, it is common to have more swelling, especially in the evenings or after you've been up on them more. However, that should go down the next day. And if it doesn't, and that lingers on for days or even weeks, that would be a good time for you to check in with a doctor or your certified lymphedema therapist to see what the cause is and if there's treatment for you. But if you have any new rapid swelling and it's hot and red and painful, that is more likely a sign of infection and you want to go to your doctor right away. The next reason to follow up would be if you have any wounds or you have any skin breakdown. Anytime you have an opening in your skin, even with a cut or dry skin that breaks down, that will put you at an increased risk for infection. Having an infection does make the lymphatic system kick into high gear, and that can make the swelling or lymphedema even worse. Some may also have an infection first, and that's what causes or flares up their lymphedema to begin with. You always want to make sure that you have any wounds or openings checked out by your doctor or your therapist. But if you also have had some skin breakdown or wounds that are not healing, even with some treatment over the wound, you also want to consider talking to your therapist to see if getting some of your swelling down may then help the wound to close and heal, because sometimes the wounds are caused by that swelling. So often I see in the clinic that if someone has a chronic wound and it's not healing, we'll go ahead and work with the wound therapist or wound specialist to help shrink that leg or that arm down, get the swelling out, and then the wound will continue to heal and make progress. Your therapist is also going to help you reach areas that you may not be able to see. So under skin folds or on your back, they can also do skin checks and see if you have any skin breakdown or any wounds that need to be addressed as well to help avoid infections. The next thing you want to make sure you talk to your certified lymphedema therapist is any thickened tissue, or what we call is fibrosis. So fibrosis will affect anyone who has lymphedema or lipedema. Lymphocytic fibrosis is caused by swelling that's sitting there too long. When the lymph fluid is chronically congested, it will pool and overflood into the area, causing worsening of the swelling. Over time, that will actually attract fat cells, which start to bind to other areas and cause hardening. It's a process that will cause that liquid to move into a gel form and can eventually work into a hard mass. There's a lot of talk in therapy and treatment, as well as training for certified lymphedema therapists, to think about preventing and decreasing the swelling. But if we think about it, if we don't address the fibrosis, which is that hardened, thickened area in that tissue, then that fluid is not likely going to be able to pass through, and we're just backing up the system even more. It just becomes a snowballed effect, so it is something that we want to address as soon as we possibly can. Your certified lymphedema therapist is going to do various types of treatment, including manual lymphatic drainage, using chipped foam or ridged foam to help soften the tissue, or something like a swell spot. They may also do something outside the box, like foam rolling, negative pressure work, or low laser therapy. For those that are certified lymphedema therapists that are watching this video, don't forget about the fibrosis. I feel like this is something that is commonly missed, especially when we do our training, but it is an essential piece of the treatment plan. The next thing is, if you have any pain or tingling, you definitely want to follow up with your doctor or your certified lymphedema therapist. Although pain is common for some, it is not normal. And lymphedema by itself doesn't typically cause pain unless the swelling is extreme. The other time someone may have pain is if their compression garments are not fitting correct. If you have the incorrect type of garment, you may be causing a tourniquet in the area that the band sits. That may even restrict the fluid even further and can cause worsening of the swelling. So your certified lymphedema therapist should be able to help you adjust to a different type of garment, look at why you may have pain, and even help monitor for any signs of infection. If you go directly to your certified lymphedema therapist, they may direct you then to the appropriate doctor or even the emergency room if needed. The next time you will likely follow up with your certified lymphedema therapist is if you have old or ineffective compression garments. If you use your compression daily and you wash it well and appropriately, they will have a life of about 4 to 6 months. After that, you will likely need to replace them so that your garments are effective and working correctly. Like I mentioned previously, it also really does matter what type of garment you're in. Whether you're in a circular knit or a flat knit garment, as well as what kind of nighttime garment or bandaging that you're doing, all of that's going to play a role in how well your symptoms are managed. Some people can get away with a circular knit. For those who have more severe lymphedema or the shape of their limb does not fit the off-the-shelf versions, they may need a custom garment or a flat knit garment that is a lot more containment. Again, a lot of this will matter. So what's best for you is likely to follow up with your therapist so they can assess what needs you have and put you in the right type of compression garment. There are hundreds of different types and brands, and they are not created all equal. So your therapist is going to have a better idea of the different styles and brands and what works well for each person. A lot of times it is trial and error. So although one may seem like it will fit best, you will then have to go and try it for a little bit, see how it works for you. And if it doesn't, come back to your therapist and see what your next option may be. The other thing to think about this is a lot of times lymphedema, lipedema, and vascular things are progressive, so it may change over time. When the garment is no longer working well for someone, we may have to adjust and put them in something else. So yes, it can get really confusing and overwhelming, and that is why it's best to follow up with your certified lymphedema therapist. Another reason you'll want to follow up with your certified lymphedema therapist is if you're going to have a surgery. There are an increasing number and types of lymphedema surgeries now, and each surgeon or doctor are going to do things a little bit different. So where we work, we have different protocols to follow for each surgeon, and your therapist can help walk you through the protocols week by week. In order for lymphedema surgeries to be successful, we do follow a strict protocol. This ensures a positive outcome and long-term success with your surgery. Another thing I see often is someone who's had something like a knee replacement and they have a history of lymphedema or swelling in the leg. A surgery of any sort is going to put some strain on the lymphatic system. So we often encourage our patients to follow up with us prior to surgery to make a plan to help keep the lymphedema or the swelling at bay, and then we'll follow up after the surgery once cleared to do so by your doctor to help get the fluid back down if needed and assess if there's any treatment that's needed further. Anyone who has a major surgery of any sort, such as a knee replacement, can have swelling on and off for up to a year after, just in the area that was surgically done. However, if we add lymphedema, lipedema, or another vascular disease on top of that, we may see more of that swelling. And for some, that may cause worsening of the issues, but for some, it doesn't. We just want to make sure that we're on top of it, and working with your certified lymphedema therapist and your surgeon all together is going to help create you the best plan of action. The next reason to follow up with your therapist may not be for a major issue. It can be simply for a tune-up. It is not uncommon to see your certified lymphedema therapist each year or a couple times a year. Some people we only see every other year. It just depends on their specific needs or what their swelling does. For me, I often see a lot of patients at the end of the summer or early fall. After the summer, the heat was higher, some have not been as consistent with their compression, or the humidity is just worse and they've been more active. They just need a tune-up to help get the swelling back down so they can fit better into their garments and avoid that flare-up. We'll just do some complete decongestive therapy with manual lymphatic drainage and bandaging to help get the fluid down from what has built up over that time, and then move them on their way back into their compression garments long term. Other factors that may cause the need to have a tune-up with your certified lymphedema therapist can be internal or external. For internal, you may see a change in body composition, progression of lymphatic dysfunction, or due to new surgeries or infection or illness. Examples of external factors can include humid environments, lifestyle changes such as traveling or diet changes, and self-care consistency, meaning those who are unable to be as consistent during whatever phase of life they're in. Life happens and that's okay, and your certified lymphedema therapist can get you back on track. The next reason is your certified lymphedema therapist can help you monitor or adjust your home program. Like we talked about before, lymphedema and other lymphatic dysfunctions can be progressive. Therefore, things will change over time, and we may need to adjust how we're treating it. We may add a different type of garment or different type of bandaging, or we may encourage you to do more lymphatic drainage or use a pump. It can vary for each person. We'll always encourage everyone to find some sort of exercise that works well for them. We know a lot of people like swimming because there's a natural compression in the water, but we also know for those who weightlift or do resistance training 2 times a week can have up to a 53% reduction or reduced need to have a tune-up of their lymphedema. So reach out to your certified lymphedema therapist and see what exercises would be best for you. It's also exciting that lymphedema research is growing so fast as well. With that comes new treatment ideas and new compression options. So you always want to make sure you follow up with your therapist to see if these new options or treatments are best for you. You may have other concerns or questions that I did not speak about in this video, but you definitely want to follow up with your certified lymphedema therapist to get those addressed. Remember that every individual has his or her own needs. One size does not fit all. And as certified lymphedema therapists, we need to make sure that we're addressing each person as their own. We need to tailor our treatments and our long-term programs or home programs to each person based on their symptoms, side effects, and lifestyle. Your certified lymphedema therapist is just a person on your team. They won't make decisions completely for you. You are a part of that team as well, and you two and other providers will work all together to make the best decisions for your health. Seeing a certified lymphedema therapist is a great place to start if you are new to any swelling. If you have any questions or any skin changes that you want to talk about, that's a great place to start, and they can also help direct you in the right place if needed. If you found this video helpful, please press the like button down below and subscribe for new videos on lymphedema therapy as well as oncology and women's health. Thanks everyone.